allowing real information so that you can allow consumers to compare and choose and then provide an easy way of enrollment. It's not just about insurance, which I'm afraid we end up talking about here in Washington. It's about the cost of health care. Because let's face it, if we don't control the cost of health care, even with insurance, you still can't afford to do it. So if I have a moment with the gentleman's permission, let me try and tell you exactly what they are doing right there, which is another avenue which is essential to understand as to what our opportunities are and what could happen if we go further with what is proposed by many of the leaders of this particular Congress. Utah is establishing a health exchange, which means any licensed company in Utah can place their programs online. The entire amount of bureaucracy to run this is 2 state employees. So far, there are 66 individual plans that are out there. This is its first year, and the pilot program already has 136 small businesses with over 2,000 employees. They average 17 employees in each company going online to use this system. Now, that's important because you've already mentioned the cost that's implied by small business. Only 43% of the small businesses in America provide insurance for their employees because they can't afford it any other way. Utah, it's even worse, only 32%. This is an effort to get around that problem. So what you allow is the workers to choose not a one-size-fits-all that's chosen by the employer, but a program that fits the workers' needs. They can use that option with pre-tax dollars. The responsibility is with the consumer who gets an annual choice. And with that, there is a pressure to keep prices down and to get quality up because everyone now is a consumer in the system. Businesses in Utah like this because their overhead of mandatory insurance increases now cease. Small businesses especially because the reason they're not giving insurance is they can't handle the insurance price increases. In this process, the worker gets money from the money that the company would be paying and any money they want to use, and then they go into this plan, and from the 66 programs, they get to choose what is there. Businesses now have a predictable cost of doing business, not arbitrary. And employees, if they don't like the one-size-fits-all, can have the opportunity of finding what they want to do. It's easy to navigate. You go into a computer system, put age, family size, and one thing we don't have today are agents of insurance companies now work with the employer to try and sell a plan. Now they work with individuals to try and service plans because they have freedom to go after any employee in the entire state. It's also portable. If you change jobs and the insurance is still in the system, you take your insurance coverage with you. Even if you don't have a job, you can keep that same insurance coverage with you. There are fewer uninsured, and those that are uninsured, the state of Utah now has a plan to handle this. This is like when I go to the grocery store and I want to pick cereal. I go down the aisle and there's all these different choices of cereal for me to pick. And I always pick the one with almonds in because I like almonds. But there are a whole lot of people that don't like almonds. They get the chance to pick their own cereal. It is not the situation in which the government should be telling me what kind of program is right for me. Not even should be the business telling me what kind of program is right for me. I should be able to pick my own program. And if you do that, you expand the consumer into the system, which puts pressure to lower the actual cost of health care. And that's the real solution. Now, the problem is we have some plans being presented both in the Senate and the House. Those plans crush these state initiatives. Those plans not only cost hundreds of billions of dollars, they decrease choices, they have potential of raising taxes, they destroy state initiatives. Utah and other states have found a better way. What we need to do is make sure that we have a system that empowers states to be creative, to help consumers become involved, and that's not what is being proposed on the floor of this House and in the Senate. What is being proposed would destroy this initiative. It would take it off the table. That's the exact wrong direction. We need to look at what the Founding Fathers had when they envisioned the concept of federalism and recognize that in federalism, in choice, and in options is our salvation. It is the future. We need to embrace that, not a one-size-fits-all government mandate, which has enormous impact, as the gentleman has been saying, especially on the small businesses of this country.
Let me go to Congressman Thompson, and then we'll go to Congressman Lamborn.
Well, I thank my good friend from Utah. I feel like I'm in the Wild Wild West tonight between Utah and Colorado. So it's good to be with you all here on a very, very important topic. It comes down to that very bold sign you have there, Mr. Coffman, 5.5 million jobs, and that's what we're at risk of losing, going down the direction we're going, and which is not necessary. I mean, we have alternatives. We have other bills, as just like the idea that you outlined just a few minutes ago. We have, and as we look, the National Federation of Independent Businesses, who kind of speaks with just one of the voices for small businesses, has been very clear about what it would like to see in health reform. It would like the ability to pull with other businesses to enjoy the economies of scale in purchasing health insurance. That's a fundamental part of what you just outlined. They want tax credits to help them to be able to afford the insurance. But what, coming back, I guess, to my my opening analysis, but what we have here is an unhappy fable under the Democrats' health care plan in which no small business will live happily ever after. I mean, I come out of a small business. I grew up in a small family sporting goods business. It was my job as a teenager to get up at 6 a.m. on a Saturday morning to open the store that was down in the front yard in front of my parents' home where I grew up. I have to tell you, at 6 o'clock in the morning felt like the middle of the night back then. But I got up to be able, because of people coming in for either picking up their supplies for hunting or for fishing, and small business is what we did. I mean, it was we worked hard at it. It was that was a my mom and dad had that. They were looking for the American dream, and they were willing to put whatever it took into it, the hours and the days, and they created jobs, and they created prosperity for other people, and they provided benefits for folks that work for that family business. And I saw the toll that one of the biggest obstacles it ran up against at being successful, and I'm sad to say that the business does not exist today because those barriers eventually overtook it. It was government. It was government that did that business in, and it's government that's a barrier that impedes many of our small businesses. It was the taxes, it was the regulations, it was the mandates. And today we're talking about health care as one more mandate that is put on our small businesses. Health care costs for small businesses across the country continue to outpace the rate of inflation, and we know that we could do a better job of bringing the cost of health care down. But it's the path that we choose is so important, because the path that the Democrats' plans are on will make matters worse. It will drive those many small businesses out of existence, and we'll lose jobs, many jobs. We have 5.5 million jobs at risk in this debate. But there are other paths that we can take, such as the ideas outlined by my good friend from Utah that we can take. There's another bill that we have out there, Putting Patients First Act. H.R. 3400. It's a good plan. It's been introduced. We've been talking about it for some time. I think the American people really need to know and get to know more about this, because it does so many different things. It allows being able to access across state lines for health insurance. It provides that competition, which is healthy and which is important. It addresses tort reform. When we talk about fraud, abuse, and waste of health care, I came out of working in health care for 28 years. And we try, as health care professionals, professionally and ethically, we work very hard to make sure that we use every health care dollar wisely to treat the patients that are there, to help make them better where we can. And one of the largest wastes, I feel, is the cost of medical liability. Nationwide, we spend $26 billion annually in medical liability premiums. And in addition to that, the practice of defensive medicine. And I understand defensive medicine. If you're practicing as a physician, you've invested, you come out of medical school, you may have $250,000 in loans as a part of that education. If you're a specialist, it may be $500,000. And because of a lawsuit, and frequently frivolous lawsuit, you're at risk of losing not just your practice, but your family's home. And because of that, you may order these tests to be able to treat specifically this patient at this time, but these other tests are ordered and put in a medical record to be able to establish that you followed a standard of care. And it's to protect you in the event that you are sued. Well, that probably is, at a minimum, is $100 billion a year annually in this country. So in terms of wasteful costs in health care that we could bring down, there's $126 billion annually just by good tort reform. H.R. 3400 does that. H.R. 3400 provides some common sense approaches to medical liability and brings down that cost for everybody, which would bring down the cost of health care for our small businesses and individuals all across the nation.
Thank you, Congressman Thompson. Congressman Lamborn, when we look at this H.R. 3200, it not only says that there could be up to an 8% surcharge on a small business that doesn't have health insurance. The schedule goes to 8% for if they have adjusted gross wages of $400,000 or more, which isn't a lot for a small business given